Just to begin, so lintuzumab-Ac225, what it represents is an anti-CD33 antibody, which is conjugated to a radioactive molecule, actinium-225. So what this radioactive molecule does is it emits high energy over a short distance, causing double-stranded DNA breaks amongst cells that express CD33, so AML. So for this study, what we looked at was combining this to our standard salvage chemotherapy regimen, which we administer in patients with relapsed AML. And so we mostly enrolled patients who relapsed or had refractory disease. These are patients who had very high-risk features. So a little over half had a P53 mutation. I think about 75% met ELN criteria for adverse risk disease. So these are essentially very refractory patients to standard chemotherapy. And so what we wanted to investigate was whether adding this antibody conjugated to radiation, whether it could improve outcomes. And that's what we potentially saw in this study. So first of all, the main purpose of this study was safety. The main parameters that we were interested in was in previous studies with this compound, at higher doses, patients experienced really prolonged cytopenias. And then transient liver toxicities were seen as well. So we gave this agent at lower doses because we combined it with chemotherapy. And we didn't see any sort of prolonged cytopenia, which we defined as neutropenia lasting over 49 days, or thrombocytopenia that essentially persisted, resulting in any sort of bleeding complication. So when we did this study, we found at the dose, recommended phase 2 dose, that we didn't have any issue in that sort. Second thing, in terms of liver toxicity, that was a particular area of interest for two reasons. One, at higher doses, there was some transient transaminitis that was seen with this agent. Other compounds that conjugate to an anti-CD33 antibody have liver toxicities associated with them. So gemtuzumab has BOD as a main side effect, or transaminitis. At this low dose that we administered, we didn't see any excessive liver toxicity as well. And so with this study, the main focus was to determine the safe dose, which we determined at 0.75 microcurie per kilogram. We also looked at how this drug cleared the system once administered. And so essentially, we did pharmacokinetics in 5 patients. We saw that radiation peaked in patients at about a half hour after administration, and radiation potentially cleared by 24 hours after administration. So nearly all patients had no evidence of radioactivity about 24 hours after this agent was given. And so we saw a lot of safety parameters in administering this agent in this way. In terms of results, we saw really promising results as well. This is a population where we anticipated perhaps responses in about 30 to 40% of patients. But at least in all patients enrolled in this study, we saw responses close to about 65% of patients. At the recommended phase 2 dose, we saw responses in about 75% of patients. Amongst patients who achieved a remission, or a remission with incomplete count recovery, 75% of those patients achieved an MRD negativity, which we assessed by multiparametric flow cytometry as well. So deep responses. And then most encouragingly, when we followed these patients out, so this study has been out now for about 3-4 years. So with a minimum follow-up close to about 2 years in the patients enrolled in the phase 1 portion, we saw survival slightly over 50% at 1 year, and close to 35% at 2 years, which we thought was very promising considering this very high-risk population. So where I see this agent going forward is certainly in our study, it appeared to enhance or deepen responses amongst patients who received salvage chemotherapy. So these deepening responses allowed probably for a greater amount of remissions and deeper remissions, MRD negative remissions. And we know with these deep remissions, with whatever next step these patients have, whether it be allogeneic transplant, which was frequently performed in our patients, it potentially can improve the outcomes or durability after that. And so these are sort of the main findings with this agent.